want to go too deep into this angle, obviously, right? Because you don't want to lengthen those quadriceps. You just want to have a 90 or less, and then you're just coming up into extension. 30 degrees, that's it. Again, enough to get my knee under. And if I rest their leg on my knee and they go into severe hyperlordosis, then I'm concerned that maybe there's not a lot of length in their hip flexors in hyperextension. Okay? An alternative, if you lay on your side, Josh, if you're working on someone who's, say, pregnant, you can do the same test this way. Just looking for 30 degrees. And again, what will happen if you go this way is they'll start to drop into an anterior tilt, and they should be able to open this up without going too much into their lower back.
So do you need to put like your hip on their glutes to keep it and then pull that way?
I would if I was going for a stretch. But now I'm just trying to assess range. If I'm having to stabilize here because they're falling over, it's because they've lost range in the hip. I should be able to comfortably get 30 degrees and Josh can stay right there.
Okay.
If I get like here and he's starting to twist that way, it's too tight. Get what I'm saying?
Okay.
I'm not trying to stretch. Now if I want to stretch it, yeah, I'll come in and I'll stabilize here and I'll stretch.
Okay.
Or, I'll put a foot up. But my goal is just to check range. The second he starts to go into rotation or whatever, he's lost hip disassociation. So that's enough. So on your back again. So hip extension. All right. So knee bent, hip flexion, 135 degrees. So again, this is 90. We're not going for 180. We're just going for that 135. Now again, we're not stretching. I could go into that 180 range for a glute stretch. But at that point, I'm having to come over here. You know how you have to stabilize that hip down? Because you're trying to literally twist the pelvis to get that opening. I'm just reading the joint. So can I get to 135 without a whole lot of compensation on that side? Which again, if I go beyond 135, you can already see his knee starting to lift up. But we're beyond normal range, so that's fine. We just want to get that one. Some people you get like right here and they start lifting up. Right? You get to like 95, 100 degrees and they're already compensating. So that's number 2, right? Checking hip extensors. Then we're crossing the leg over. And so here's 0 degrees here. All we're doing is we want about 20 degrees of hip adduction without a whole lot of rib compensation. So you can even come up here and grab the ribs to feel and push. And feel if there's any compensation there. You get nothing from Josh. Now if I go far enough into it, I still feel a whole lot from him. He's pretty open there. Right? But I want to just feel if anything here is starting to pull. Okay?
Oh, the good hip.
The good hip. All right, and then again, going into hip. Again, if I want to stretch, I'll bring the foot out here. And I'm just checking the range. The second I get compensation, I'm done. So right now we are, about 60, 70 degrees right now. I could push a little bit more. I could probably get Josh easily to 90 right there. You're not going to need a lot of people who can do that. You can also tell he doesn't need to go into external rotation on this side. You keep that foot pretty straight up. But please watch that because a lot of people will go into rotation, and here's the thing. If he rotates that hip out, I'm sorry, but he's not adducting anymore. I'm now officially testing his hip extensors again. Right? I need to keep that hip straight to make sure that I'm testing the adductors of the leg. So if you get that, sometimes, so for me, if they start to rotate, maybe that's their end range. Maybe that's where I say, okay, that's as far as they're going to go healthily. And then again, that's his homework. Can you do leg raises on your side or even on your back if they need it more simple and keep that hip in neutral, right? Which again, for Josh, what good is it going to do him? He's lost cartilage in his hip. But if they have that support, that would be the homework. Then we did face-up rotation. So again, internal rotation going for 45, external rotation going for 60. So we get a little bit more range in external rotation. Josh can easily get 90. There's no problem. Very little compensation. So his issue is internal both directions. A lot of people, that's the pattern, right?
Yeah, I can't say very often are you going to find some people that have 45 degrees of internal rotation. There's only one person that I've tested in school that has it, and that's Kelsey right now. She's the only one, but it makes sense because she's a sprinter.
Yeah.
So I've never really run across too many people that have really clean, good internal rotation. Not to say it doesn't happen, it's just few and far between. Because if you think about it, when we sit, most people are sitting like that in their cars, sitting like that at their desks. The external rotators are usually pretty tight.
What's funny is me and Josh really had to sit down and work on numbers because there's a lot of variation, and we really don't go by them. We go by feel. We kind of have this mental expectation of what a joint should feel like, and that's what we go by, like a look, right? And so, I mean, you can easily put a number to it, but again, some numbers might be you might find an awful lot when you test your people. Like everybody's going beyond that 45 in abduction. So again, that's why we raise that number up a little bit to 75 or 80, because you don't need to expect 90, but 45 most everybody's going to get. But to me, for healthy, and to Josh, I mean, you want to be able to get a little more than that, right? A lot of people won't be able to, and that's okay. That just means, and who doesn't need adductor work, right? I mean, that's just pretty normal. But you know, you want to be able to get a little bit more than that 45, you know, but not quite 90. So. And again, you don't need to pull out a goniometer. It's just a general sense, you know, practice and get a sense of it. So,
I need to give that a
And
different
height
name.
would be-
what's that?
Goniometer.
Oh,